work in Kisumu County at the County Department of Health Offices. I coordinate NCD screening services. Thank you. So my topic is factors influencing cervical cancer screening uptake in women of reproductive age in Kisumu. It was done in one of the sub-counties, Kisumu West. So cervical cancer is the fourth most common cancer affecting women globally in the world today. And in Sub-Saharan Africa, it's also a major cause of mortality and even morbidity. Over 5,250 women were diagnosed with cervical cancer, and out of this, over 3,200 died of from the disease, and that is quite a very huge number. So in Sub-Saharan Africa, it has been identified as having the highest incidence of cervical cancer in the world. It is also associated with high mortality, affecting women at their most prime age within the reproductive age. Good thing is that cervical cancer is 100% preventable. So this was a study conducted, and the main objective was to determine factors influencing cervical cancer screening in Kisumu West. And the objectives were to establish health system factors that affect cervical cancer uptake in GOK facilities within Kisumu West, and also to assess the level of knowledge on cervical cancer in women of reproductive age. So the methodology, this was a cross-sectional quantitative study, and it was conducted, of course, in Kisumu West. The target population were women of childbearing age, 15 to 49 years. At least one was pregnant at that particular time or had one child, and of course who accepted to participate in the study. 2 service providers per site also offering cervical cancer screening were identified and selected in the sampled facilities. So the methodology, the sample size determination, was adopted from Mugenda and Mugenda of 2003. There is the formula and how we reached the sampling size. And out of the sampling size, we administered 392 questionnaires, which were completed and analyzed. So the difference in 384 and 392 was because of the additional 5% which was added in case of missing or incomplete questionnaires. So we used pre-tested structured questionnaires for cervical cancer for women of childbearing age, then self-administered questionnaires for service providers to determine their perception on barriers to accessing cervical cancer screening. We also used observation checklists to verify the availability of commodities and supplies, and also desk reviews were conducted to enable comparison of the findings of this study with previous conducted studies. So the results from Objective 1 as shown below, and these were human resource and training on cervical cancer. These were the facilities that were sampled for the study. The first column, as you can see, those were service providers, then those who were trained, and the proportion. So overall, the scenario is the same across all the facilities. And we can see that a very minimal proportion of clinical staff had been trained on cervical cancer, 11%. That is 9 out of 80. So on cost of screening, which is also a health system factor, generally clients had mentioned that they had not incurred any cost, but 13 clients, that is 3.3%, had incurred some cost in relation to cervical cancer screening, and this was in one health facility only. So on level of knowledge on cervical cancer screening, we see that quite a significant number could correctly define cervical cancer screening. However, the majority, 58%, could not identify or could not correctly define cervical cancer. And again, 4% did not even know what cervical cancer was or is. The other one, this other objective result was on sources of information Also, respondents' knowledge on cervical cancer, and majority received the information from healthcare workers. And also, there are those who had prior knowledge, but on this particular study, about 90% had received information from the health facility. And an awareness of screening services at the facility, 33% were not aware, while 66% were aware of screening services in those facilities. So the recommendations, actually this study revealed the importance of cervical cancer, improvement of cervical cancer, access to cervical cancer screening if we are to improve the uptake in our, or overally. And so for efficient service delivery, it is important that we integration is key of cervical cancer into screening, into other existing programs in MCH, outpatient, other areas, and also even during outreaches. We are trying to integrate it as much as possible, even in our outreaches, and expanding opportunities for screening for any hospital patients or even visitors. So for efficient service delivery, it is necessary to understand what the minimum package of care is. So what do we need in terms of human resource, in terms of commodities and supplies, for us to be able to offer efficient cervical cancer screening. And to address barriers, there is a need to employ appropriate health promotion and prevention messages, both based on also the findings per region or for this study, appropriate health promotion and prevention messages. Then there is need for further research to expand the specific infrastructural gaps that affect cervical cancer screening. So I would like to acknowledge the County Department of Health in Kisumu for their support in my work and in cervical cancer screening. USAID Boresha Jamii, who has supported us to be able to disseminate this, and also, of course, my most amazing family for their continued support. And as I finish, I'd like to say that let us be part of the increase of this uptake as nurses, as healthcare workers. The females here, if I asked how many have been ever been screened, I would be surprised, isn't it? I would be surprised. We did this screening in Kisumu for our health service providers in our two major facilities, JOTRH and Kisumu County Referral Hospital, and it was nice, but watu wanaogopa kupimwa. And also the men, don't be left out. Your partners, your spouses, your loved ones. Thank you very much.